Welcome to our webinar explaining Tricare for Life. This webinar will cover what is Tricare for Life, what are Medicare Parts A, B, and D, Medicare and Tricare eligibility, Medicare enrollment, and Tricare coverage and other information. Tricare for Life, or TFL, is Medicare wraparound coverage for Tricare beneficiaries who have Medicare Part A and Medicare Part B, regardless of age or place of residence. There is not an enrollment form with Tricare for Life. TFL coverage is automatic if you have Medicare Part A and Medicare Part B. Part B premiums are required. Title 10 of the U.S. Code 1086 specifies that a person entitled to premium-free Medicare Part A isn't eligible for Tricare unless the person also has Medicare Part B. The only exception is when the person does not have Part B due to active duty status. Tricare pays after Medicare in the United States and U.S. territories. For all other overseas coverage, the Tricare Overseas program is the first payer. TFL beneficiaries are also covered under the Tricare Pharmacy program. For additional Medicare information regarding Part B premiums, please visit medicare.gov or ssa.gov/forms. You can also call the Social Security Administration at 800-772-1213 or TTY-TDD 800-325-0778. What are Medicare Parts A, B, and D? Medicare Part A is hospital coverage funded through payroll taxes. It helps cover costs for inpatient hospital care, hospice care, inpatient skilled nursing facility care, and some home health care. Medicare Part B is medical coverage funded through monthly premiums. It helps cover costs for provider services, outpatient care, home health care, durable medical equipment, and some preventive services. Medicare Part D is prescription drug coverage. You don't need a Medicare Part D prescription drug plan to keep your Tricare prescription drug coverage. Medicare eligibility is generally determined by birth date. TFL coverage begins on the first day you have both Medicare Part A and Part B coverage, unless you are active duty. The Defense Manpower Data Center will send notification of the requirement 5 months before your 65th birthday. For Medicare eligibility, if your birthday falls on the first day of the month, you become eligible for Medicare on the first day of the month before you turn 65. Sign up for Medicare 2 to 4 months before the month you turn 65. If your birthday falls after the first day of the month, you become eligible for Medicare on the first day of the month you turn 65. Sign up for Medicare 1 to 3 months before the month you turn 65. There are situations in which you can become Medicare eligible prior to age 65. For example, Medicare eligibility can occur due to severe illness, injury, or disability. Medicare begins on the 25th month of receiving Social Security disability benefits. End-stage renal disease or permanent kidney failure can also entitle a person to Medicare. Medicare coverage would begin on the 4th month of dialysis, the 1st month of home dialysis, or the month admitted to a hospital for a kidney transplant. People with amyotrophic lateral sclerosis or Lou Gehrig's disease may also be entitled to Medicare. Medicare coverage would begin the 1st month a person with ALS receives Social Security disability benefits. Individuals with mesothelioma or other asbestos-related diseases who live in Lincoln County, Montana, may also be eligible for Medicare coverage. For additional information on Medicare eligibility, please call the Social Security Administration at 888-482-3128 or visit medicare.gov. Medicare does require enrollment and has guidelines. If you don't sign up for Medicare Part B during your initial enrollment period when you first become eligible for Medicare, your next opportunity to sign up for Medicare Part B is during the general enrollment period, which runs from January 1 to March 31. Coverage begins July 1 of the year you sign up, and the monthly premium for Medicare Part B may increase by 10% for each 12-month period that you could have had Medicare Part B but did not. If you're covered by employer-sponsored health coverage based on current employment, you may delay enrollment in Medicare Part B without the penalty explained above. You may enroll in Medicare Part B anytime while you are covered by an employer group health plan based on your or your spouse's current employment status, or during the first 8 months following termination of the coverage. The Medicare Part B late enrollment surcharge does not apply. Regardless of the provision, you must have Medicare Part A and Part B to have Tricare for life. Delaying enrollment in Medicare Part B results in a break in Tricare coverage. Tricare Open Season doesn't apply to Tricare for life because enrollment is not required. You can learn more about Open Season with Tricare at tricare.mil/open season. Please ensure your records are up to date with Tricare once you are TFL eligible. Be sure if you have a Medicare Enhancement, Medicare Cost Plan, Medicare HMO, or any supplemental coverage that you contact customer service at 866-773-0404 or update this as a registered user at tricareforyou.com. Any questions regarding Medicare coverage can be directed to State Health Insurance Assistance Programs, or SHIPS. SHIP's mission is to educate, advocate, counsel, and empower people to make informed healthcare benefit decisions. SHIP is an independent program funded by federal agencies and is not affiliated with the insurance industry. SHIP offers free help to Medicare beneficiaries and offers counselors and workshops or presentations in your area. You can find more information at seniorsresourceguide.com/directories/national/SHIP/. Tricare for Life benefits start the first day that Medicare Part A and Medicare Part B are in effect and you meet all other eligibility requirements. You may see a Medicare participating or non-participating provider for medically necessary care covered by Medicare and Tricare. If seeing a non-participating provider, you may need to submit the claim yourself. You can choose to see an opt-out provider, but expect to see higher out-of-pocket expenses when selecting this option. For more information regarding Medicare providers and benefits, visit medicare.gov. If receiving care at VA hospitals or clinics when the rendered care is not service-related, Tricare will only pay 20% of the allowable Tricare charges, leaving 80% remaining as patient liability. The VA must file the claim. The Tricare for Life costs associated with coverage can be located at tricare.mil/costs. To see the Tricare for Life cost matrix, visit tricare.mil/TFL. Tricare for Life does not issue separate cards showing coverage. Once you are registered in the Defense Enrollment Eligibility Reporting System, you'll be issued a Uniform Services ID card. ID cards are issued at an ID card office. See the URL on screen for the Rapid Site Locator. You can show your Medicare card and your Uniform Services ID card when receiving care. If you have misplaced your Medicare card, call 800-772-1213 or visit socialsecurity.gov. If you have multiple insurances based on current employment, the other health insurance generally pays first, Medicare will pay second, and Tricare will pay last. If the other health insurance is not based on current employment, usually Medicare pays first, the other insurance will pay second, and Tricare will pay last. If submitting a claim with the Tricare for Life contractor, you should submit a DD Form 2642, a copy of your provider's itemized bill, the Medicare summary notice, and any explanations of benefits from all other health insurances. You can download Form DD2642 at tricare.mil/claimforms/medical or at tricareforyou.com. If you are a registered user at tricareforyou.com, you can submit the claim online. You must file TFL claims incurred in the U.S. or its territories within 1 year from the date of service. For more information on Tricare, you can review any of these resources: tricare.mil/TFL, tricare.mil/publications, or tricareforyou.com. The following reference items are available and can be downloaded from some of these sites: the Tricare for Life Handbook, the Tricare and Medicare Turning 65 brochure, Tricare and Medicare Under Age 65 brochure, and the Tricare for Life Cost Matrix. We hope you enjoyed this webinar on Tricare for Life and how it works with Medicare and other insurance. Please follow us on Twitter, like us on Facebook, and look for our other upcoming tutorials. Thank you.